Results from a new health survey reveal women are experiencing the effects of the pandemic more than anyone else. And it also finds that COVID fears are stopping people from seeking routine health care. Senior Medical Director Dr. Harvey Kaufman joins us now to talk about this survey and why Americans need to get back to preventative care and testing. Good morning, doctor.
Good morning.
Women are disproportionately bearing the negative impacts of this pandemic. Can you tell us what else the survey revealed?
Sure. Let me tell you first about the survey itself. So we were guided by our mission to empower people to take control, to improve their health outcomes. So we collaborated with the Harris poll and surveyed more than 2,000 American adults across the spectrum, across the United States, to better understand what's behind the catastrophe of the pandemic. And one of the findings was that women are being disproportionately affected. They expressed more concerns about stress, about mental health and physical health conditions, and about the financial hardship of the pandemic. Now, one reason is women tend to be the caregivers in their nuclear and extended families. And so they put those priorities first and neglect their own health at their own peril and of their loved ones.
Another thing in the survey that you found is that a lot of people have this fear of exposure to COVID-19, and then that leads to them delaying routine or preventative care. So what's the impact when they delay those types of healthcare visits?
Yeah, so in the survey, 60% of adults said that they delayed or canceled an in-person medical visit during the pandemic. That's a lot of people. And when people re-engage and see health professionals again, there'll be a delay, and some people will have more advanced disease. It will affect organs in their body, in some cases irreversibly. Some people will need more aggressive therapy that will be less effective. And unfortunately, some people will die as a consequence of this delay.
And who are the people that are most at risk when we talk about delaying care?
It's really everyone. So we looked at the Quest Diagnostics data, and for infants and toddlers, there's a gap in testing for lead. Many school systems waived the requirement early this year. There's younger adults who aren't getting screened for chlamydia and gonorrhea who are sexually active. And among older adults, there's gaps in care for screening for hypertension, diabetes, chronic kidney disease, and many other health conditions. If we focus on cancer, there's gaps in care for screening for cervical cancer, prostate cancer, colorectal cancer, mammographies for breast cancer, colonoscopies, all sorts of things, and vaccinations. So this delay will lead to a certain number of people having more advanced disease that's harder to treat and will have worse outcomes.
And as we mentioned, a lot of people, they're worried about getting tested. What did it show with that? Because they don't want to get tested because they think they're going to be exposed.
Exactly. So one of the more shocking findings was that 74% of the people who felt that they needed a test either delayed or didn't get tested for COVID-19. So they're putting themselves at risk. They're putting their families and communities at risk because we can't identify people who need treatment, who need interventions if people don't get tested. And people who aren't getting tested, who should be tested, who think they need to be tested, can infect others who can get very sick. And if people wait until they're in respiratory distress, they're more likely to be admitted into an intensive care unit and have more adverse outcomes because of that delay.
So what's the biggest lesson that we should take away from this survey?
It's always a great question to reflect back on what we've learned. We learned so much about SARS-CoV-2, the virus. We learned so much about COVID-19 and what's effective and the unprecedented speed in developing a vaccine. Those are all the science and the medicine, but what the survey shows is what's in our hearts and what's in our minds is fear, anxiety, concerns, and we need to overcome that. We provided a website, questdiagnostics.com/peace of mind, that provides information, facts to confront fear so that people can re-engage with their health care and receive the care that we really need.